Hello, I'm Dr. Mike. Urinary tract infection is a very common problem found in dogs. Unfortunately, many pet owners may not realize their pet has an infection. For a brief overview of urinary tract infections in dogs, we're going to visit with Dr. Jeff Glass.
Urinary tract infection is an infection that occurs in the urinary tract. This is usually divided up into 3 different places that it can occur. It can be in the lower urinary tract, which is below the bladder, in the bladder, or above the bladder in the kidneys. It is very difficult to know where dogs get urinary tract infections from. Sometimes it can be from the skin, sometimes it can be from lying on a contaminated environment, sometimes it's something that can come via the blood. But to be very frank with you, we don't really know where these infections come from in many cases. The signs of urinary tract infection can be very varied. Sometimes we'll find a urinary tract infection coincidentally with the dog showing no signs at all, and sometimes it can be where owners will complain of the dog urinating more frequently, urinating small amounts, blood in the urine, even pain urinating, and sometimes we'll see dogs that drink more, and that can often be a sign of urinary tract infection. To diagnose urinary tract infection, it will be based on the clinical signs that your dog will show. But it's always important to try to get a urine sample to be able to get a correct diagnosis. If there's evidence of infection, it would be a good idea to get a culture of the urine as well. Collecting the sample can be done in various ways. You can either bring a sample into your veterinarian or they can collect one using a catheter. The best way to get a sample would be directly from the bladder because that's a sterile sample with no contaminant at all, and therefore if we do see a problem or infection, we know that it's actually in the bladder or alternatively in the kidneys. The way that this is done is by putting a needle directly into the bladder, which can be done by holding the bladder or alternatively with an ultrasound to guide that needle into the bladder. Both of those ways sound more dramatic than they really are, but it's no pain or discomfort or risk to your pet at all. It's important to diagnose urinary tract infections early because sometimes the infection that you see or the bacteria that you see in the bladder, it can just be only part of the problem. What happens is that bacteria cannot survive in a very acidic urine, which is the normal urine of a dog. What the bacteria does is they release enzymes which change the pH, in other words, make that no longer acidic and make it something called alkaline. When that happens, there's a chemical procedure that happens, and that results in crystals often forming in the bladder. These crystals can be very irritating to the bladder, and when many crystals form together, they can result in bladder stones. And often it is necessary to remove these stones via surgery. And also this infection can then possibly migrate up into the kidneys and result in a kidney infection, which is a lot more serious and dangerous than a bladder infection. If you treat the infection early, we can avoid this from happening. Treatment of a bladder infection is very varied. It can depend on the bacteria that you find in the urine, which ideally you want to diagnose on a culture. And when you do a culture, you can then do a sensitivity. What a sensitivity is you are testing the bacteria against various different types of antibiotics to determine which is the best antibiotic to kill off that infection. Usually that is all that's necessary if it's a bacterial infection. There can be different types of fungal yeast infections, but those are pretty rare. If there are stones or crystals in the bladder, sometimes they can be dissolved by various foods, and sometimes it's necessary to do surgery to remove those stones. After completing the course of antibiotics, it is really important to know that the infection is absolutely resolved. This can be done by collecting a urine sample and sending it off to the lab for a culture where they will attempt to grow out the bacteria that were in the bladder. If the culture is negative, we can know for sure that this infection is gone. Sometimes we will see that different bacteria can grow, or alternatively, we can find that the same bacteria is continuing to grow, which means that either we have not resolved the problem or we have a resistant bug and we need to change to a different kind of antibiotic.
It is important to recognize the signs of a urinary tract infection. If not diagnosed, these infections can lead to a severe illness or even the formation of bladder stones. Many dogs do not show any clinical signs of an infection. That is why I recommend that your pet have a urinalysis performed during their routine physical exam. I'm Dr. Mike, and thanks for watching.